Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another one of our Facebook Live events. It's sporting my new balaclava here. I'm starting to get so used to it now, I barely even notice it. So let me take it down so you can see my lips for those people who are doing lip reading. So it is Friday, June the 19th, and this is about our 30th one of these things. And as we usually do, we start from the top and then move on down. So from the world view, this pandemic is still very active. We're up to 8.6 million cases and about 460,000 deaths. The daily case counts, which is really the thing to look at here, is the number of new cases every day is really going up, and the daily death rate is not decreasing. So if we were testing more, finding lots of asymptomatic cases in the world, the case rate may go up, but the death rate should then go down, and we're not seeing that. So still a very brisk death rate. And what we're also seeing is spreading in so many parts of the world. So India, Brazil, Chile, and Peru seem to be really hotspots for this disease. But now we're starting to see some other hotspots in the Middle East, especially in Pakistan. And Pakistan is very worrisome. Poor central government, lots of distrust of outsiders. So we think it could spread very quickly in places like Pakistan. In the U.S., it's still very active in the U.S., with 2.3 million cases and about 120,000 deaths. Now, we didn't think we would get to 120,000 deaths until much later this summer, and we're already there. In the U.S., still very active in California, about 4,000 cases a day earlier this week. Texas, Florida, Arizona, and Oklahoma. Oklahoma, a bit concerning because this is where they're going to have this big rally tomorrow. Lots of people close together for long periods of time. So we're holding our breath on that. So for Oregon, this has been a very active week. For a few weeks ago, we had talked about having the 20 to 80 cases a day and being kind of stuck there. And the wave in Oregon was this little ripple. Well, over the last couple of weeks, it's really been very active. So now we had never had a day over 100 cases, and now every day is over 100 cases. And 2 of the days have been over 200 cases. We still have a relatively low attack rate and a relatively low death rate compared to other states, but that suggests there's a lot of disease out there to be to have that many cases. Now, of the new cases in Oregon, some are related to 3 very large outbreaks and then a bunch of smaller outbreaks. The really large outbreaks at the Oregon State Penitentiary, at the food processing plant in Lincoln County. And this last week, a really big outbreak centered around a church in La Grande, Oregon, where they've had well over 200 cases, and they may, by the time they get done with it, have even more. So that really is a big concern. There are, the positivity rate in the state has gone up a little bit, so suggesting that these new cases are not just because we're testing more, but that there really is more disease. In addition, there are some sporadic cases throughout the state. These are cases not associated with anybody or anything else, which are just showing up, especially in the Portland area, and we're worried about those. We don't know what they're related to. We don't think they're related to the protests, but it's really hard to tell because they do seem to be so sporadic. So more cases, big outbreaks, increasing positivity rate in sporadic cases, all very worrisome. And I think that's why the governor chose to delay reopening last week and slow it down this week. Douglas County, still very quiet. We have had 4 cases over the last 2 days, but these have been in several groups that traveled out of state to visit relatives who turned out to be sick and later had COVID. The Oregon people came back to Oregon, were appropriately quarantined, adequately tested, and found to be positive. So this is not spread in Douglas County. This is what happens when you visit areas where there's high amounts of disease. Now, when you have sick relatives, you want to visit, and we totally get that. But you need to recognize that's a very high-risk situation. And if you get in that high-risk situation, you need to give us a call so we can be sure that you get adequately quarantined and adequately tested. Now, we think in all of these cases that the people have done everything exactly right. The quarantine's been perfect. So we don't think we're going to see any more cases from them. But again, this tells us that this disease is right at our borders. Lincoln County is a couple-hour drive. Even La Grande's only a 6-hour drive. These places are close. And so we do have to worry about cases coming into the county and then seeding it in the county. We still are doing a bunch of testing. We're still having a low positivity rate. We're still having, our positivity rate is less than 1%, very good. We're still doing testing. We did testing earlier in the week. We did testing again today. We're going to do a bunch more testing next week. So we got it. I've got so many things here along the way, so if there's ever a break in the questions, I'm going to bore you with all the things that I picked up. But I'll do your questions first. That's most important. So put them on the chat section, and we'll get them. So when somebody dies, are they just marking them as COVID so hospitals get more money, says Linda? Well, this is a conflation of two different rumors that are out there, and I'll tell you what they mean. So hospitals get paid on what's called a DRG basis. So if you come in for an appendectomy, hospitals get paid a certain amount for an appendectomy. They get more for brain tumor. They get less for a smaller procedure. And these are all based on very complicated things that CMS does that says about how much it costs to take care of a certain patient. Well, taking care of COVID is very expensive. Right? These people are frequently on the ventilator, frequently for a very long time. And so the amount that you get for a COVID case is much more than you get for a case of a simple pneumonia. Because a simple pneumonia, you're in the hospital for 2 or 3 days, get some IV antibiotics and go home. The average length of stay of somebody with COVID is 12 days. Many of these people die. Some stay in the hospital for months, as our fellow up in Portland. And so the hospitals overall do get more money if they have COVID cases than non-COVID cases. But that's based on the fact that it costs more to take care of COVID cases. Hospitals are not marking the kid with a perfectly little pneumonia as COVID, because the only way they can do it as COVID is if they're presumptive or a confirmed case. And so I know that rumor's out there, and it is true that hospitals are getting more money to take care of people with COVID because that costs more to take care of them. I saw a story the other day that this 70-year-old man got treated for COVID and had $1 million hospital bill. That's not shocking. I think the bill for our guy is going to be at least that. So Linda says, how is this not like the flu, and how it compares death-wise to the flu? So this is a great question. We've answered it a few times, but we'll do it again. So the flu death rate, there are two flu death rates. One are confirmed flu cases that die in the immediate period of having the flu. And that's one flu rate. But the flu rate that we hear, the flu death rate that we hear about is really the excess deaths that are associated with flu. And that's the number that you hear, that's 30, 50, 60,000 a year. For COVID, we're only counting the cases where you have a pretty firm diagnosis of COVID and then die then. If you compare them in the same way, either the way to do it would be have confirmed cases of the flu that died or confirmed cases of COVID that died. A really elegant study in JAMA Internal Medicine looked at them, and using the same comparison, COVID is 20 times more deadly than the flu. And I think any of us who've looked at it understand it's 20 times more deadly than the flu. So in many cases, COVID is somewhat like the flu, but it's 20 times more deadly. Now, flu gets people at all ages. Bad for kids, bad for pregnant women, bad for older people, bad for seniors. This disease seems to be really bad for seniors and not particularly bad for pregnant women, not particularly bad for kids, not particularly bad for young people. So in some ways it's the same, but in some ways it's really quite different. And I think that JAMA Internal Medicine article is just beautifully written and says it's 20 times more deadly than the flu. And that's what I believe. All right. So assuming these new cases became infected a week or so ago, how ill have they become and how old are they? Well, again, we're not going to give specific ages. There's a wide range of ages of this group, and all of the people are outpatients, so they may be somewhat ill, but they're not seriously ill. Again, most of the cases we're going to see are going to be 20 to 100. We've seen no cases in people less than 20, as is typical. And that's one of the things we'll talk about today is the data about kids. And so now schools have opened in France and Denmark and other places around the world. So we're getting some information about kids and the disease. And it seems that kids are three things: less likely to get the disease. So when there's a big outbreak, their rate of attack is lower. Less likely to get really sick with the disease. So very few hospitalizations, deaths, not zero, but very few hospitalizations than deaths, and very less likely to spread it. So in France, when they've looked at outbreaks in schools, almost all of the cases in schools have come from the parents who gave it to the kids. They can't really find any cases where kids gave it to other kids. So it really does seem in many cases the kids kind of are the dead end for this infection. And that would be a good thing because that gives us a lot more confidence about reopening schools. Yeah, so Mary says, this is a great question. Is her blood type more susceptible to COVID? We looked at this early on. It suggested that A blood type was bad for you and O was good for you. I'm B, so I'm in the middle. That A was bad for you and O was good for you. And it does seem now that as they've looked more, not that you're more susceptible to disease, but more susceptible to complications. So that when they look at the people who have disease, they have kind of the normal distribution of blood types, but the people who get really sick are much more likely to have A, and the people who are less sick are and the people who have O are much less likely to get sick. So there does seem to be a blood type thing, and we don't know if it has something to specifically do with the blood type. But the blood type gene is on a chromosome linked to other parts of the chromosome. So it could be something about the blood type itself or something that it's linked to. But this is a very interesting thing and may give us some insight if we had some therapeutics about what's going on there, why the people with type O do so much better. Is there something either about something in type O blood or something near the type O blood gene that's doing it? Now remember, type A blood, your chromosome codes for either A or B, and if you have neither A nor B, you have type O, so there isn't a specific O gene. So Tracy said, what are the requirements from medical facilities to screen patients before entering the facility so they're not exposed in the lobby? There are no very specific requirements. I know most hospitals, thanks for that. I know most hospitals are screening patients before they come in, as are many businesses, by asking questions and doing temperature screens, but there are no specific requirements of hospitals to screen patients before entering the facility. So I think patients for most elective surgeries, most hospitals are doing a preoperative COVID screen. There's some data behind that suggesting that people who were brewing COVID and had elective surgeries didn't do as well as people who weren't. So that's why they're screening people. But I don't think they're screening medical patients. Now, if any patient comes in the hospital and has symptoms suggestive of COVID, they should get screened. So Misty says, are antibody tests helpful? So antibody tests could be helpful in a couple of ways. In a research world, they're very helpful for knowing how many people have had the disease. So if you had a perfect antibody test that was both very sensitive and very specific, it could kind of tell you who had been infected in the past, and that could be a great use. Antibody tests could be helpful if you're looking to donate convalescent plasma, which we'll also talk about later. And if you don't have antibodies, you can't donate convalescent plasma. Antibody tests could tell you that you're going to be immune to this disease, although good data came out this week suggesting that the antibodies are probably only going to protect you for 2 or 3 months. That is really disappointing. We were hoping that they would do it for a year or 2 or 3 or maybe a lifetime, but the data that came out this week suggested may not protect for that long, and that's why the antibody tests may not be that helpful. Now, the other problem with antibody tests is when the FDA opened up antibody tests, they let anybody who wanted to make an antibody test get out there. And some of these tests were crap. I mean, they had really low sensitivity, really low specificity, and they were pulled off the market. Those tests are probably not worthwhile. But if you get a test from one of the reputable labs, Mayo, LabCorp, Quest, I think you can trust the result. When I get an antibody test, wouldn't do anything for me. I don't think I had the disease, so I can't diagnose. I can't give plasma, and whether or not I had it, I'm still going to take precautions. So, did any of the 4 cases this week know each other? Well, there were 2 family groups. So there were 2 family groups. Presumably, in the family they knew each other. So there's 2 family groups that make up these 4 cases. So Dana says, if schools are open, will they have to be sanitized daily? And are there going to be health checks for kids daily? Yes, they want to sanitize schools a lot. So you could share a lot of things and then clean up. Far better just not to share things. So, in the past, schools might have stuff that kids would share along the way. I think what we're going to see in schools is you're not going to see very much sharing of things. You're also going to see more sanitizing, but it's really the decreasing the sharing rather than trying to sort of clean off every crayon in between kids. Are they going to do health checks for kids every day? They are going to do oral health checks for kids. Well, they're going to ask their parents whether they've had any of the symptoms suggestive of COVID. They are probably not going to do temperature. They're not required to do temperatures, and I don't think most schools will do temperatures. So Kurt says, why is it so hard to get tested in Douglas County? My question is, why do we keep getting this question? It is not hard to get tested in Douglas County. If you want a test, call your doctor, get an order. If your doctor doesn't want to give you an order, if you don't have a doctor, call Aviva Clinic at 541-459-3788, and you can get a thing. So Kurt, if you could give us a little thing in there about why you think it's so hard, because boy, it really isn't. And again, the Aviva number, she gives it to me, 541-459-3788. That's 541-459-3788. So one of the really big things that came up this week is a study from England that suggested that Decadron could be helpful in treating people with severe COVID. That is great news. So in the past, when I talked about remdesivir as a bunt single, if this is really true, this is a double in the gap. This really could make a difference because it suggested that it could decrease the death rate by as much as a third of the sickest patients, and that would be great. Decadron's a medicine we use a lot, use it for a long time. So as a pediatrician, we use Decadron all the time for kids who have croup. So if your kid has croup, comes in croup, and we give them 6 milligrams of Decadron, even for a little 1-year-old, we give them 6 milligrams of Decadron, and the chance that they're going to wind up getting really sick from the croup goes way down. The dose they're giving adults is 6 milligrams, so they're giving a big 200-pound guy the same dose as we give a little 1-year-old. So it's not a very big dose of Decadron, and it's just once a day for 10 days, so it's not really a big dose. But it did seem to have a big help, so we'll see. I'm a little skeptical, and the reason I'm a little skeptical is right before this good data came out about Decadron, somebody looked at all the other studies of steroids, and all of the other studies of steroids were not very helpful. They suggested it didn't really make a big difference. So I'm really hoping that it's going to be positive, but it's a little funny. So Shelley says, what are the current Douglas County suggestions for elderly people planning to attend Father's Day get-togethers? So Father's Day, what a great day. There is some risk when we visit, especially some risk if we have large family gatherings. So the recommendation would be smaller gatherings would be better than large gatherings. Outdoors, always so much safer than indoors. We've talked about this again and again, but it is really hard to find a case where there's been a lot of transmission outdoors. Almost all of this transmission of the virus has occurred indoors or inside a bus or ship. There's so little transmission outdoors. So if you want to go ahead and have a safer thing, do it outdoors, do it with 6 feet of distancing, limit the size of the groups. That's pretty safe. Certainly if anybody's sick, they should stay home. If there is anything you're going to transfer between people, you should think twice about that or try and clean it in between. But the deal is it's important for us to see our families. And I think with the relatively low number of cases in Douglas County, this would be not an unreasonable thing to do. So with this new antibody data, will there be a focus on therapeutics? This is an interesting story. So you can go back to these early days of this, and when I talked about how this would end, one of the ways that I thought it would end would be with a vaccine. One of the ways could be with good therapeutics, and one could be a preventative, be it hyperimmune globule or monoclonal antibody or something. So we thought that there are opportunities there. I think at this point we are moving full steam ahead on at least 6 different tracks. So I'm seeing full stream ahead on several different vaccines. These vaccines are new and different. We've never had a good vaccine against a respiratory coronavirus. We've never had an mRNA vaccine, and yet we're going full steam ahead on the vaccine front. We're going full steam ahead on the therapeutic front. We're going full steam ahead on the biologic front. That would be like convalescent plasma, hyperimmune globulin, or monoclonal antibodies. So I think we're going full speed ahead on all of those. and you'd be foolish to predict which one is going to win the race. One is going to win the race, or maybe several will win the race, but I don't know. So how long is the incubation period, Diana asks. 3 to 14 days. Well, 3 to 14 days is what we typically say. We will tell you that when you look here, there's a real peak at 5 or 6 days. We don't see very many less than 4, and we don't see very many more than 10. So really sharp peak at 5 or 6 days. So Janet says, I was tested for COVID today for a knee replacement. Good luck with that. What's the chance I could get it at the hospital? I think really low. So medical procedures, you worry about being in the hospital, other people there. The hospital has done a very good job of infection control. So I think at the current time, with very low rates, they have nobody in the hospital now with COVID that they know of. I think the rate is pretty low. Certainly, it's much lower than going to an airport in anywhere, traveling to La Grande or traveling to the coast. So I would confidently go ahead and get your knee replacement. I would be cautious about having lots of visitors, right? Because you don't know that the visitors haven't been exposed. And I would be, as best you can, to do as much as you can at home rather than a rehab center. So Mary says, how risky do you think is travel to see family in Josephine or Jackson County? Well, Josephine and Jackson County are a little closer to California, where they've had 4,000 cases a day. And so it's a little bit more dangerous. Staying in Douglas County would be safer. Those areas are a little more dangerous, but both of those counties have still had relatively low rates. Again, if you want to decrease your risk, do it outdoors. We're going to have beautiful weather this weekend. Do it outdoors. There is no reason to be inside with Dad this weekend. Do it outdoors. Dads like the outdoors. Go outdoors, go fishing, go hiking. Those we think are very safe activities. 20 people in a room starts increasing the risk. Okay, a couple other things we want to talk about. One is the Union County outbreak. So Union County out where La Grande has an enormous outbreak. Well over 200 cases, mostly associated with the church in Union County. This church certainly didn't follow all the guidelines. They had big services before they did. They didn't do a great job with social distancing. And if you look at the map, there's been a fairly good-sized outbreak in Umatilla and southern Washington, and sort of close to where they're at. So, as people travel and go to churches and whatever, there's this big outbreak. It's a big outbreak, with over 200 cases, a bunch of hospitalizations, and a bunch of other really sick people. So what it shows us is that could happen anywhere. I mean, La Grande and Roseburg, not really all that different. It could happen there, it could happen here. So please, please, please still be careful. A couple other things that I have here is they've got the data in from New York looking at the risk factors, the age, the race risk factors, and whatever. And what it shows is what we've seen before, is that older people very, very, very much more likely to be affected than younger people. Blacks and Latinx far more likely to have bad disease than young people. People with underlying conditions, especially hypertension, kidney disease, cancer, underlying immune conditions, neurodegenerative disease, much more likely to die than people who didn't have it. So if you look at sort of the relative risk of a 30-year-old with no underlying, a 30-year-old white guy with no underlying conditions versus an 80-year-old with black 80-year-old with underlying conditions, the difference in death rate is about 50-fold. So this really is a disease that gets our seniors and gets minority populations and gets people with underlying conditions. So we have to be careful about that. So one of the questions that I get many times every day is, well, these restrictions are so miserable. These restrictions, the closure of businesses, the other kinds of things are so miserable. We really should just open things up and let it happen. So we've done some modeling about that. And the modeling of that would be that if we would do that, Oregon would have about 1,000 cases a day. And Douglas County would have about 40 cases a day. So wouldn't be that every day. Some days we would have only 20, some days we would have 100, but we would have about 40 cases a day in Douglas County. The infection fatality rate, that is of the people who get the disease, how many die, the thought is about 1% of the people who get the disease die. Now, I know there are going to be people who say, oh no, there's this German study at 0.4, and then I'll point to other studies where it's 1.5. It's going to be somewhere between 0.4 and 1.6. Douglas County being a relatively old county. I mean, we're one of the oldest counties in the country. We would clearly have an infection fatality rate of at least 1%. So we had 40 cases a day in Oregon, in Douglas County, Oregon. We'd have 5 or 10 hospitalizations a day. The average length of stay in the hospital is between 5 and 10 days. So that would suggest we would have between 20 and 50 people in the COVID ward of the hospital every day. We would have between 2 and 6 deaths a week every week. And you say, well, that would be okay because it would just kind of blow through and then people get it. And eventually, maybe everybody would have enough immunity to get it. But you would need to have about 60% of the population, or about 60,000 people, get the infection. And doing the math, that's 1,500 days. So this would be an incredibly awful 5 years. I mean, because during that time, while the hospital has 20 or 50 patients at a time, there's no way they could do any elective surgery. And I'm not sure you could keep staff for very long. What we've seen in New York and in Italy, that this, we who work in the hospital deal with that. We see bad things and people die all the time. And we're used to working long hours, and we're used to not being able to help some people who have diseases we can't help. And that happens. But what's been seen in both Italy and in New York is that the people who went through this say this is nothing like any time they've ever done. That this was much worse than any time they'd ever been through. And many are reporting symptoms of PTSD, anxiety, depression, sleeplessness, and all kinds of strife that goes with that. So if we're talking about having 20 to 50 people in the hospital every day with COVID, that is such a miserable look. And if we think businesses now are a bit restricted, if you have that many cases and that many deaths, there's going to be nobody who's going to want to go out. There are going to be a lot of people who are so frightened of what goes on that they're going to stay in the houses, and that too is going to interfere. So if somebody's got a better idea of how to handle this than what we've done in Oregon, which is what I think is moderate restrictions and a gentle easing up along the way, I would love to see the written plan, because I've gotten a lot of criticism about the plan we have now. I hate that plan. It's stupid. It's hurting businesses. And I totally agree. It is hurting businesses. There is no question it's hurting businesses. I'm the president of the YMCA, and I see how tremendously it's affecting that. I see patients all the time, and when I see patients and I ask them how they get through this, some are doing okay, but many have lost their jobs. Many don't know how they're going to pay the rent next month. Many of the people work for companies that are going out of business. A lot of people who previously had insurance now on Medicaid. So I totally get that this is horrible. But if somebody has sort of another suggestion on how to deal with it, we'd love to see it. We do have some experiments around the world of other places who've dealt with it differently. So, we've talked about Sweden now for the last 6 weeks, because Sweden took a less rigorous approach. They didn't take a nothing approach. I mean, they closed down big gatherings, they closed down schools, but they didn't close down bars and restaurants and other kinds of things like that. Their death rate is 10 times higher than neighboring countries. 10 times. I mean, that's pretty terrible. And their economy is suffering just as bad as everybody else, and they're nowhere near getting this under control. So Sweden is a great example. Brazil was the other example that they were going to just let it blow through, and Brazil is totally awful at this point. So if somebody's got a good model, I would love to see it, or you don't have to write it out yourself. If you have it, put it on the chat, and I'll look at it tonight, because I have looked for the alternate plan, and the alternate plan isn't there. So if the alternate plan isn't there, what are we doing this too fast, too slow in Oregon? I mean, I don't know. I don't think we're doing it too fast. I don't think we're doing it too slow. I think we've about hit the mid-range here, but it's really tough. So so all of those people who write all these other kinds of stuff here, please, please, please let me know what your plan would be on doing this. And I'm really totally open to listening. I really want to learn on this. If there's a better thing out there, I would want to do it. And it wouldn't be a day if we didn't talk about masks. So masks are so controversial. And again, as we've said from the beginning, public health has not done a good job. I'm doing public health in the bigger sense. World Health Organization, CDC, our leaders, the state, everybody else has not done a great job in explaining about masks. So you remember, to give back the history, when this came out, there was some movement to use masks, and we were worried that people were going to buy up all the surgical masks and all the N95 masks, and then there wouldn't be any for medical personnel. So our Surgeon General, Jerome Adams, said, oh, don't use masks. They're not going to help you very much, because at that point we didn't know about pre-symptomatic spread very well. We don't think it's going to help you very much, and please don't buy them so we can have them for other people. The WHO said, we don't think you need masks unless you either have the disease or are caring for somebody with the disease. And they said that because masks were not easy to come by in much of the world. The Chinese, the Koreans, the people in Singapore definitely said use masks. So you've got all this conflicting information. Then later on, the CDC said, well, we're seeing a lot of these super spreaders who are spreading it before they are sick, before they have any symptoms. And they're spreading it sometimes to as many as 20 people. And boy, if they would wear masks, they could decrease the spread to others. And if you look at my famous Facebook video with the spray cans, you could see that a mask really does decrease the droplets if it's close to your face. And it doesn't have to be even a very good mask. Even just a home-constructed cloth mask or a balaclava can help spread many of those things. So the reason you're wearing a mask is to protect others. But it has become so darn emotional. Oh my goodness, I hear that last week there was a stabbing as two people were arguing about this and they get in a fight and it wound up with a stabbing. Please, 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 we don't need to be stabbing each other about using masks. But please, I think we can help prevent others. You know, for me, for 20 years, I wore a tie. When I was in the military, when I was in residency, when I was in the military, and the first few years here, I wore a tie every day. And nothing is more ridiculous than a necktie. They're other than being a fashion accessory, they're ridiculous. You know, they would lean into my food. They would lean into kids. We thought that they transmitted germs. They were hot and uncomfortable to wear. So I just stopped wearing, about 15 years ago, I just decided I'm going to stop wearing a tie. And life has been good. But I did that for years because it was really just a fashion statement or because it was sort of expected. Now, when I wear the balaclava, it's much more comfortable than a tie. It is kind of ugly, I would guess. But if I can prevent somebody else from getting sick, it's worth it. I mean, think of how terrible I would feel if on June 27th, I come down with a cough and stay home, and then they say, oh, Bob, you tested positive for COVID. Who were you around before you had symptoms? And I say, well, you know, I was at a meeting at the Y, and there were all these people around, and nobody had masks on. That's not true, because I would never do that. Or I went to dinner with a bunch of friends, and we got close. And now what I find is that I'd given it to 5 or 6 or 8 people. That would be really hard to live with. I mean, I'm in an age group where the people who are my age peers have about a 5% death rate. So if I gave this to 20 people, one of those could die. And boy, I mean, how could you ever live that down? And so I wear this as protection against others. It's probably not going to help me very much, but it may help others. I mean, it doesn't cause you to die from wearing a mask. I mean, surgeons who have been out doing this for 40, 50 years wear a mask for 8 hours a day. And again, the reason they wear a mask is not to protect them from the patient, but to protect the patient from their spittle. And so they wear these masks 8 hours a day, and you know, their immune systems are pretty darn good. They don't die of hypoxia or any other things. So all of these negative mask things really have to be taken with a grain of salt. If we have people who are really sick, who've got very low airflow due to neurologic disease or to emphysema, they shouldn't wear a mask, but that's probably 1 or 2% of the population. The rest of the 98% of us, I would recommend you do. Now, are we going to come up with a law about it? I really hope not. I really hope, just like many other nice things that we do for people, we can convince people to do this without making a law or a rule. All right, so some more questions here. So I asked a couple of months ago if treatment with ribavirin compromises your immune system and makes you more susceptible to catching it, Jessica says. Yeah, so ribavirin is an antiviral treatment. It's not very effective. So we've used it for years for things like respiratory syncytial virus. It was used for a little while for some of the kinds of hepatitis. So the Chinese did try it. Ribavirin does not seem to help with this disease, but it didn't seem to make it worse either. So I don't think that ribavirin will make you more susceptible to catching it, but I don't know if that was specifically studied. Yeah, so my daughter is in San Jose and Salinas. Any concern or advice for when she returns? Well, so, the advice could range anywhere from, well, we're not doing anything specific for those people, good luck, to if you really, really needed her to be safe, for her to quarantine for 2 weeks. If she would come, stay in her room for 2 weeks, have a separate bathroom, don't play with the pets, have her meals delivered to the door, self-monitor for symptoms, and if she had symptoms, get tested. And if she went 14 days without symptoms, the chance that she would be infected is vanishingly small. That's pretty hard to do, right? So pretty hard for her to come back and you say, look, daughter, you are banished to your room. I mean, I used to punish the kids and send them to the room for an hour or two, and that was like the world's greatest torture. It's hard to imagine sort of banishing someone who's come back and wants to see friends and go outside and do all those things, to banish to their room for 2 weeks. So you could do nothing. You could banish them to their room for 2 weeks. What else could you do? Well, in the middle could be avoiding big gatherings and careful self-monitoring. So that would be, well, we're not going to have the big party with 38 other kids from town. I'll be here in the family, but I'll socially distance. I'm going to very carefully look for any symptoms. And if you went 10 or 11 days without any symptoms, your chance of having this again would be very low. Now, you could have had an asymptomatic case, but again, we don't think asymptomatic cases generally spread very much. So that would be somewhere in between. But a lot of this depends upon what she's got. I mean, if she's only got a week to be home, having her quarantine for 2 weeks doesn't seem to make, that wouldn't be a very nice trip. On the other hand, if she's going to come back and be back for the summertime, you might consider doing that. It would also be who else is in the family. Well, if you're living with 90-year-old grandparents, I would be much more towards the quarantine. If it's just going to be you and her, and you're both relatively young and healthy, you could be a little bit more to the left. I don't think I would do nothing. I think at a minimum, I would carefully self-monitor and carefully look for symptoms. If he has symptoms, to go into isolation and get tested. So that's sort of a mid-range thing, which I think would not be unreasonable to do. Okay. Well, I think that's everything for the day. Okay, so we're going to continue to do this. We'll be back on Monday. We may in the future move from Mondays to Tuesdays because of another engagement. But next week we'll see you Monday at 6 o'clock. Again, a couple of things. Stay safe. And again, to stay safe, a couple of things. Maintain distance. Definitely stay home if you're sick. Avoid crowded places. Do things outdoors if you can. And really do things outdoors. I was talking with a friend today, and she was talking to me about all the great bike rides she's taking. And I totally encourage that. Again, we think the risk of getting this outdoors is very low. So this is the great weekend to go hiking, to go biking, to go for a long walk, to go look at things at the coast. Now, at the coast, I would be careful. Golfing, yes, Brian is telling me golfing is good. But golfing, again, you should be 6 feet away from your partner. It would probably, if you can, get one to a cart and do good golfing. Anyway, again, this is Dr. Bob Dannenhoffer, Public Health Officer. It's June the 19th, and thank you for joining us. We'll see you again on Monday.